And this is another cannula. But this is a 4 millimeters. But usually I use the 6 millimeters just for the neck, all the time. Okay, and with this cannula, you see the tip and the hole is because I'm trying in the platysma just like to sweeper that excess of fat above above the platysma. Okay, and to leave much better that kind of folds. And if you see, almost I'm finished this area and no bleeding, no swelling, no nothing, because we are working with the right instruments and in the right area. We don't damage the muscle, we don't damage any other structure. We are very superficial, just you need to take care about the skin. And with that cannulas, they protect very well that skin. Remember that the patient is just with local anesthetic and she's without any pain at all.
You gave her any sedation?
No, any sedation. Usually I do the sedation because I put I can imagine that I am the patient, you know. I am a doctor, but and you will feel afraid. Usually I use some pill for sedation.
Like
and they feel like, yeah, Valium, something like that. Yeah. But in some patients say, no, don't put me nothing because okay, look at this girl. As a matter of fact, she's talking with me, and almost we finished this area and the central part, and you can see the contour of this. And look at this is to check the no irregularities, no nothing, no swelling, no bruising, no nothing. And then we remove the excess of solution, and we are going to check how many cc's we remove from that neck. And she's ready. And the 24 hours is very important, especially for the skin is a flap. We need to put in the new position. And we need, look at this, the patient is very happy. After that, one stitch in every hole, and like the doctor Susie said, just in the face, because in the body you can let open that small incisions, but in the skin it's very important to close those incisions. And this is a very cold gel, and then this is another like a pack of gel, and it's in the refrigerator. Then we put here, because we do a damage and a traumatic, so we need to protect that, not too much swelling in that area. Okay, then the bandage, this bandage is just for 24 hours, the next day is just a special gargle. And now the cheek is very unusual. This is just along the cheek, but I'm going to show you this because I would like that you need to protect the fascia, because that fascia is very, very thin. Okay, so sometimes when I do the facelift, I can see the fat from the what's the name? And then we need to work just with like I explained the doctor, just with the syringe and this small cannula. And it's just under the skin. And it will be like almost 10 cc's in every cheek. I never tried to remove the what is the name of the buccal fat? Thank you. Buccal fat. Never do that. Never. It's not necessary. It's they look very old later. And it's easy to resolve that, just transfer fat there, and that's it. But they never do that. This is the cheek, look at how much I removed, and let's go to see very fast the other areas. Never behind of the anterior part of the muscle. This is the anterior part of the sternocleidomastoid muscle. So never behind, never do anything here. You know, remember, there are a few fascias there, and then the jugular external vein, and also the auricular nerve, so don't do anything kind of this. And sometimes I mark how much I'm going to remove, but it was wrong. Instead of 5, it was like just in the jugular like a 12 cc, just 5. And like I told you, it's not in all the cheek like the other girl, just in the jugular area, and also in the cervical area too. And look at the fat, this is just real fat. When you wait the 20, 30 minutes, look at this, any damage, any blood. Is, now let's go to see the parotid area. And usually, look at this, all the areas in this girl, and especially, let me see, this is the parotid area. And sometimes when I do the face lift, also I can work in the open liposuction, the parotid area. And we remove all the fat there. It's much better control. Okay.
Where was your incision for parotid area?
Depends. You can find. Also into the hair, it will works.
Can you go downwards?
No, it's very small incision. Remember, it's very small. And the cannula, because it's very small, is almost noticeable. I'm going to show you here in the parotid area. So if you see, I did incision to this girl here, and look, it's not noticeable. And if you see this moon face, I work all the areas, but especially the parotid area. Look at this. That moon face is changed. And look at this guy. So look in the parotid area. Okay, and also I put the chin to improve also this face and to remove this double chin. But the most important is the parotid area. Look at this. And where are the incisions? Remember that we need to camouflage that incision. And look at this girl. This girl is the next day. This is not bruising. This is like a erythema. It's correct to say that? In 2 days disappear. So if I did this on Friday, she can go to work on Monday. But look, the skin responds very well. All the skin go back. And look at this, the jowl and the cheek liposuction. Look at this result the next day. And also this, she went with another doctor and he wants to do the face lift. But sometimes with liposculpture you can do this without any face. It's like I told you, sometimes you just can do the sleeve and then very good liposuction and to work a little bit the mass. And the result is very good. But in her case, it's just the liposuction. It's just the liposuction in the jowl area and in the cheek. And look at these folds disappear. And I'm going to show you patients later. And this is the cheek area. This girl is she came when she was 15 years old, and I did the nose. And she came 2 years later for the cheek area, and I did the cheek, and then she comes later for the breast augmentation. But this is the nose, this is the liposuction in the cheek. Very young girl and very pretty. And this is when she came for the breast augmentation. So if you do a very good job, you explain, the patients come easily. You don't need just do a very good job, and they will come for more surgeries if you are a very good conservative cosmetic surgeon. And this is the cheek, but with all the other areas. But she's young, and then all is go back, and she looks very nice, and she looks like a no surgery. Okay, in all the areas on the face, but especially in the cheek. I work all the cheek. And now let's go to see the cervical and the most popular liposuction in the world. This is cosmetic surgery. Look at 2003, she came in 2007. Okay, look at the folds, no folds, look, she's still with a very good result. I did the nose too, at this, but look, the liposuction, when you talk with your patients, and then she came for another surgery. It's like I explained you before, and this is anti-aesthetic. So if you do very good liposculpture in the cervical anterior area, look at this. You can control this without any problem. Thank you very much.